Thank you, everyone. We are starting our session. My name is Dr. Kamran Ali. I am chairman of Appna Social Forum Committee, and I am president of Pakpak National Board. I want to welcome Dr. Nahid Usmani, President Appna, and Mr. Ervin Massinga, Deputy Assistant Secretary of South Asia Affairs. I would like to introduce first Dr. Nahid Usmani, and then I will introduce Mr. Ervin Massinga. Nahid Usmani, Appna President 2020, is Professor of Pediatric Hematology Oncology at University of Massachusetts Medical School. She is the founding president of New England chapter of Appna and the founding chair of the Appna Merit Committee, which is involved in teaching, training, and research with medical universities and colleges in Pakistan. She is an activist in her New England community and has been involved with Appna for 30 years. Please welcome Dr. Nahid Usmani.
Thank you so much, Kamran, for that kind introduction. Welcome and thank you to Mr. Massinga, who has been a big support and a supporter of the Pakistani American physician community and has partnered with us on many of our initiatives. And we look forward to further deepening our relationship with Mr. Massinga and the State Department Pakistani South Asian desk here. So briefly, this has been a unique year for Appna with the COVID pandemic, with our inability to hold in-person meetings. But the work that Appna does continues. We have been extremely successful this year in launching our philanthropic and our educational initiatives, which are not dependent on in-person meetings. To date, Appna has collected almost $1.1 million for COVID relief, and we have spent more than $900,000 on various initiatives, both here in US and in Pakistan. We have spent about $300,000 for food rations in Pakistan and about more than $200,000 for food aid in USA. For personal protective equipment, we have spent more than $200,000 in Pakistan, and that includes all areas of Pakistan, including Balochistan, Sindh, KPK, of course, Punjab, big and small towns throughout. And we have spent $136,000 for personal protective equipment in USA. In the last month or so, we concentrated looking at the spike of COVID-19 cases in Pakistan in providing oxygen and, and we have spent about $65,000 for oxygen cylinders. In about 200 of them were given throughout Pakistan. And then another $13,000 plus were given for concentrators and cylinders, primarily in Islamabad and Rawalpindi areas. These were mostly for indigent patients who could not afford oxygen for home supply. And the work continues. We are expecting that there is going to be another spike in Pakistan after Eid. And the most impacted people in Pakistan are the daily wage earners who are going to go through more deprivation, food deprivation, wage earning deprivation, etc. So we are going to be concentrating on those two elements to help support the Pakistani population. Where the education is concerned, Appna Merit, Dr. Shahid Rafiq is the chair of Appna Merit, and they have done a phenomenal job of having daily webinars for the first month after COVID, and then weekly webinars, multiple webinars over the weekend addressing COVID-19 issues in various hospitals, training nurses in taking care of COVID patients in the ICU, having psychosocial support for healthcare workers, and the work continues where Apna Merit is concerned. Where the advocacy committee is concerned, we are very proud that out of the 213 young physicians who matched in USA in training program, in spite of embassies closing their visa section or reducing the staff, American embassy reducing its staff in Pakistan, we have been able to get the majority of them here in USA in time to start their residency. And this has been done with a close collaboration between the advocacy committee, the State Department, the visa consulate, and the ambassador, the US ambassador in Pakistan. So there is much to be proud of in being an Apna member and the work that we have done. We hope to have further collaboration on different aspects. We had been working on launching a primary care initiative for Pakistan. As you know, primary care is the backbone of all healthcare delivery in any country, and Pakistan has a poorly organized primary care. And we, as Apna, are joining hands with the health ministry in Pakistan, the various family medicine experts in Pakistan and internationally, with partners in UK, Europe, and Australia, all Pakistani descent, who are all aiming to have a systematic approach in improving the primary care access, availability, and quality of care available to Pakistani population. So there's a lot to do, and we continue to march on. And inshallah, we look for more collaboration between State Department and Apna in doing all these charitable and educational interventions. Thank you so much, Kamran, for allowing me to speak.
Thank you so much, Madam President. And I would like to introduce Mr. Ervin Massinga. Mr. Massinga is the State Department's Deputy Assistant Secretary for Pakistan Affairs within the Bureau of South and Central Asia Affairs. He previously served as Director of the Office of Pakistan Affairs with SCA. Mr. Massinga is a career foreign officer since 1995. Prior to becoming Director of the Office of Pakistan Affairs, he served as Deputy Chief of Mission in Khartoum, Sudan from 2016 to 2018, and in Conakry, Guinea from 2013 to 2016. Other assignments include domestic assignments in the State Department's Bureau of Intelligence and Research, the Bureau of Energy and Economic Affairs, and at the Office of the United States Trade Representative. Mr. Massinga is a graduate of Georgetown University School of Foreign Service 1990 in the University of Washington's Graduate School of Public Affairs. He is the recipient of several State Department Meritorious Honor Awards and the Superior Honor Award. He speaks Spanish, French, and Mandarin Chinese. Please welcome Mr. Massinga.
Well, thank you so much. First of all, I would like to thank Dr. Usmani and Dr. Ali, for your kind introduction and the opportunity to speak today. to this illustrious Appna membership. It means a lot to me personally and to the Department of State and our government overall that you're spending an hour with me during your weekend for this discussion. We at the Department of State really value our relationship with Appna and have for many years. This relationship represents Appna represents talent and does such important work both here and in Pakistan. And that has never been more true than now during this COVID pandemic. I'm glad that we were able to organize this webinar today to discuss the significant impact COVID-19 is having on Pakistan, both to lives and to livelihoods, and what the United States has been doing to address this, and how the pandemic will shape U.S.-Pakistani bilateral relations going forward. I'm also pleased to learn from Dr. Usmani and others about Appna's many contributions to COVID-19, the response to COVID-19, both here in the United States and in Pakistan. This is something that we've been following very closely, and we very much appreciate getting updates and information of the many activities of Appna over the recent months. It would be difficult to find another organization so uniquely situated and suited for such a challenging task as Appna. COVID-19 is challenging the world, the United States and South and Central Asia, and certainly we cannot ignore that the United States continues to grapple profoundly with this pandemic here on our own shores. We all know the devastating impact it has had on many lives, economically and physically and socially. We are all challenged with how best to adapt to this new global situation in which we find ourselves. At the same time, bad can come from good. We see, both here and in Pakistan, how crises and challenges bring out the generosity of individuals and communities. Crises offer opportunities to demonstrate U.S. leadership and build on our historic partnerships with Pakistan and other countries. The U.S. government has a long-standing partnership with the people and government of Pakistan, something you all know very, very closely and very well. Our engagement focuses on private sector and locally driven solutions to the development challenges, and as a whole of America approach, a whole of U.S. government approach, with many agencies and entities engaged, both public and private. The U.S. government is by far the largest health donor in the region, investing $6.7 billion in the last 20 years, much of that in Pakistan. The U.S. stands with Pakistan in its fight against COVID-19. That has been true and will be true until the end. The U.S. and Pakistan are long-standing partners in tackling global health challenges, and this partnership has been critical as we work together against COVID-19. Indeed, we've made Pakistan a priority country for emergency COVID-19 support. Specifically, we have committed $28 million in new funding to support Pakistan through the CDC, USAID, and the Department of State's Bureau of Population, Refugees, and Migration. This includes the 200 ventilators which President Trump personally committed to Pakistan. The first 100 of those arrived in Pakistan on July 1st. And all of these have been delivered to 33 hospitals around the country based on an agreement between the National Disaster Management Authority and provincial health departments. Even before Pakistan reported its first case, USAID responded to the Pakistani government's request to adapt a procurement system for commodities essential to the COVID-19 response. USAID worked with airport authorities to design a database to identify potential COVID-19 cases among passengers based on their symptoms and their travel history. Throughout their long-standing collaboration with Pakistan, USAID and the Centers for Disease Control have trained health workers and ensured people have access to safe and effective care. Since 2006, CDC has supported Pakistan's National Institutes of Health in establishing the Field Epidemiology and Laboratory Training Program in Pakistan, which has now trained more than 550 field epidemiologists and supported establishment of 10 disease surveillance response units and responded to 680 outbreaks throughout 2019. Alumni, staff, and fellows around the country have been integral to the COVID-19 response. It is this fantastic foundation of U.S.-Pakistan health partnership that we have built upon in designing the COVID-19 response. Now that our COVID-19 cooperation with Pakistan is fully underway, let me give you a few examples. USAID is funding 4 mobile laboratories to help the Pakistani government expand COVID-19 diagnostic capabilities. USAID will refurbish, equip, and hire experts for the federal and provincial emergency operations centers. USAID will support training health workers for home-based care for COVID-19 patients with mild symptoms and respiratory care for those hospitalized with more severe illnesses. USAID is supporting private sector investments in quality control for the local production of remdesivir and personal protective equipment. AID is also providing $5 million in cash support under Pakistan's HASA initiative for those most acutely impacted by social distancing and lockdowns, and supporting small businesses and farmers to adapt to COVID-19 related challenges. COVID-19 challenges everyone in Pakistan, including the American citizens who live there. Since the beginning of the pandemic, particularly during the period in which commercial flights were grounded, the State Department repatriated nearly 3,500 Americans, including many Pakistani Americans, through charter flights to the United States, a massive undertaking. Our embassy and consulates in Pakistan have also encouraged fellow citizens to sign up for our Smart Traveler Enrollment Program, known as STEP. Through STEP, Americans receive security and health updates from our embassy so they can stay up to date in this rapidly changing situation. Please encourage your family and members that are U.S. citizens living in Pakistan to sign up for STEP by going to step.state.gov, step.state.gov. Especially now, the U.S.-Pakistan Health Partnership is delivering positive impacts for our peoples. We will keep looking for ways to deepen our collaboration with new technologies and resources to achieve our shared goals of health and prosperity for our peoples. I'd like to talk about another area of cooperation. We've always prioritized women's economic advancement, which has been so critical to U.S. economic growth since the 1950s. The International Monetary Fund estimates that closing the gender gap in Pakistan could boost the country's productivity and growth by up to 30%. In the aftermath of the global pandemic, supporting women to advance economically will be even more important, ever more critical. We continue to support a broad array of efforts through the U.S.-Pakistan Women's Council, a public-private partnership between the United States and Texas A&M University, working with U.S. and Pakistani member companies and organizations to advance women's entrepreneurship, employment, and access to educational opportunities in Pakistan. Under the Council, member companies and organizations commit to advancing women in the economy in Pakistan, recognizing that this is both good for society and good for business. Through the Pakistan Million Women's Mentor Initiative, for instance, the Council is working with Council member STEM Connector to connect 1 million women and girls to mentors in the next 3 years. To date, KFC, Zafa Pharmaceuticals, Citibank, S&P Global, and the Resource Group, among others, have already pledged to mentor 26,000 women and girls. The Council is also advancing a supplier diversity initiative to help women entrepreneurs in Pakistan source local, regional, and global supply chains in coordination with Council member We Connect International and Vital Voices. I encourage you to connect with my staff member, Radhika Prabhu, the Executive Director of the Council, for more information. Her contact information should be in the chat box. The Department of State lauds the commitment of diaspora organizations to help communities in South Asia and the United States in the COVID fight. We are encouraged to see that Appna, through its merit program, offers a series of training webinars for healthcare providers dealing with the impacts of COVID-19, including one for critical care nurses. In addition to this support, we are glad that Appna has raised over $1 million for food, PPE, and medical equipment. We welcome and value this partnership. And I remember joining the webinar helping train critical care nurses or intensive care nurses in, I think, just last weekend. Very importantly, we are actively messaging about the good work we do, both U.S.-Pakistan COVID-19 partnership and the ways that the U.S. private sector is stepping up, and the good work of vibrant diaspora communities and organizations like Appna. I hope that you have had the opportunity to see our tweets and other social messaging platforms talk about our great pride that we take in the work that you do. Thank you for your time, and I look forward to answering your questions.
Thank you so much, Mr. Massinga. As we can see in our chat box that everyone is appreciating the role of State Department, particularly the state. So the floor is open for questions. I would like to invite Dr. Mubashir Rana for first question. Dr. Mubashir Rana is the Vice President of Appna, and he is current chair of Communications Committee. Dr. Mubashir Rana, please ask the question.
Yes, yeah. Thank you, Mr. Massinga. Can you hear me? Let me put on the
I can.
video. Yeah.
Yes, I can.
Okay. Let me. Yeah. So, well, firstly, thank you very much for spending your time over the weekend with us. We really appreciate it. So, my question was, in March, the CARES Act infused hundreds of millions of dollars into USAID. I know you have mentioned that $28 million have been earmarked, and already ventilators have been supplied, and lab equipment and training for healthcare workers and so on. So my question was that is there more monies that have also been earmarked over time, especially when the vaccinations become available in future? Would that be made available to Pakistan as well? Because that is the key to really controlling the pandemic. Thank you.
That's a great question, and I very much appreciate it. I'm sure this is something that is on everyone's minds. So I can tell you that from my vantage point as the Deputy Assistant Secretary for Pakistan Affairs, and also the acting number 2 within our overall bureau, South Central Asian Affairs. So I have responsibilities for the entire bureau. I have seen and have been part of the process to evaluate the COVID-related needs throughout our bureau, and certainly Pakistan, and to divide scarce dollars, scarce resources to worthy projects throughout the countries in our area of operations. Pakistan, again, as I mentioned, has led the pack due to the fantastic capacity of its health system to absorb resources in collaboration with the United States, and of course, due to the acute need. Of course, other countries are also partners with us and suffering greatly due to the pandemic. There have been 9 tranches of considerations of applications for the resources provided by the CARES Act and other appropriations from our Congress, 9. And so that $28 million has come over through those nine tranches. Going forward, and you mentioned when a vaccination becomes available, going forward, there probably will be additional opportunities for looking at funding opportunities based on the appropriations that have already been made. And of course, Congress and the administration could agree in the future to provide additional resources. I don't want to speak for them, but I can easily imagine that when and if a vaccine is made available, that the demand worldwide will be incredibly great. And we as a people, we as a planet cannot adequately address this pandemic until everyone is safe from it. No country is immune from it, and no country can hide from it. So we will all have to cooperate in some manner to use and deploy the resources that we hope that medical science and the research community will be able to provide as quickly as possible. And if the US Congress and administration decide to make more resources available, certainly our Bureau will be looking eagerly at ways to deploy those and to do that in Pakistan.
Thank you so much, Mr. Massinga. I would like to invite Dr. Shahid Rafiq. He is the chair of Merit Committee. He has been doing a tremendous job. Dr. Shahid Rafiq, please ask your question.
Thank you, Kamran. Great program. I would first of all thank you, Mr. Massinga, for being our guest of honor the other weekend when we initiated the nursing program webinar for critical care nurses. My question is about the USAID. I know that this is a very broad program, and it encompasses many different issues. But my question is related to healthcare. I know USAID has that section, and we have been talking to USAID members for a long time, and we have a MOU existing between Appna and USAID as it relates to healthcare in Pakistan. But I would like to ask if you know any obstacle or what should we do more to streamline this. We have not been successful in materializing any project in the past few years that I've been the chair of Appna Merit. So that's my question. Thank you.
Well, thank you so much for that question, and I very much value the opportunities to speak candidly and freely with my friends in Appna. You all know that I have spent, that we have together developed a tremendous relationship. I've traveled around the country to spend time with you. I've gotten to know many, many members throughout the U.S., and I have had the privilege of seeing so much of your great work, both here in the U.S. and in Pakistan. So I consider this relationship to be one of my most important in my jobs. And you mentioned the webinar that you all launched last week concerning critical care nurses, where I had the opportunity and the great privilege of spending a little bit of time and a little bit of an opportunity to see what you're doing. And thank you so much for that and the information that you all have been generous in providing me to help USAID. AID asked for input on the appropriate technologies that we could collaborate with the Pakistani government to provide non-invasive ventilation options for patients that merit that. We do have an MOU. That MOU has been in existence for a number of years, and I know that the functioning of that MOU has been subject of a lot of questions and discussion, and there is always an opportunity to improve, both on our side and on our partner side. I have a weekly meeting with the directors of USAID's Pakistan office, and I've already told my staff and my friends at AID that coming from that conversation that we just had last week and the question that you're posing just now, that this is an urgent topic of conversation for me, how we can take the relationship and the MOU we have, that platform, and take the operation of that MOU to the next level. I would tell my friends in Appna that do be patient with us in the U.S. government. Do be patient with our friends in AID. We've had to reduce our staffing in Islamabad, our embassy in Islamabad, considerably by a good percentage to reduce our footprint and to reduce our vulnerability to this very pandemic that we're discussing. That means necessarily that the personnel available to engage and monitor and evaluate and develop new programming has been reduced. The very issues that have made productivity here in the US more problematic, the fact that so many of us are teleworking and not going into the office to adhere to social distancing principles, which are so critical to flattening the curve and helping to protect our society until a vaccine is available. It makes management of policy processes here in Washington more complicated than they would be otherwise. We're managing, we're adapting, but do be aware of that issue and be patient with us. But again, I will be talking with my AID colleagues about this idea and trying to foster a conversation, an urgent conversation between Appna and AID on the functioning of the MOU before the end of my tenure, which will be coming up, sadly, sometime in the next month or so.
Thank you so much, Mr. Massinga. I would like to invite Dr. Lubna Naeem, who is past Secretary of Appna, for the question. And panelists, please mute your mic after asking the question. Thank you.
Thank you, Kamran, and thank you for coordinating this wonderful webinar. It is quite informational. And thank you, Mr. Massinga, for attending and giving such valuable information. We definitely have lots of questions about visas. And we understand how the US diplomats worldwide, they were brought back home. Where do we stand in getting the US Embassy and consulates staffed back to 100%? And do we have a time frame? We all know this is so essential in effectively completing the visa processing. Thank you.
Yeah, that's a great question. And I know this is uppermost in the minds of many of our friends around the world, particularly diaspora communities who are anxious about connections with loved ones and family and friends in countries overseas. And that's no more true than in Pakistan and with this community. So you may have heard about the Diplomacy Strong framework that has been adopted by the Department of State as a mechanism to mirror the phase 1, phase 2, phase 3 approach that you see in most states and most localities around the US. So that just as the US economy and US municipalities are gradually ramping up their openness, given various factors related to COVID-19, we too have a phased program. And so it's a flexible one that depends on the local conditions. So here domestically, the Department of State here in Washington, DC, evaluates local conditions in the Washington, Maryland, Virginia region to make determinations about when we can move to the next phase of restaffing our department, the department downtown in Washington, and looking at what level of staffing we would have there. This is true throughout our facilities in the United States. This is true overseas too. Local conditions really dictate and determine how quickly and how fast we can move forward. Sadly, because of the current situation in South Asia and in Pakistan in particular, we're not at phase 1 yet. Phase 1 would allow for an initial restaffing and initial reopening of essential services, including visa services. I think visa services are not part of phase 1. That there might be emergency visa services, but then the more general visa services would be available under phase 2. I'd need to go back and look at that in greater detail. But what's important to recognize for this conversation is that because of the continued intensity of the pandemic striking Pakistan, Pakistan is still considered a phase 0 country. And so we're only essential staff are being allowed to deploy back to Pakistan. And we look at those numbers and the individuals and the functions that they carry out very, very closely, because we are intent on maintaining as small a footprint as we can while keeping our embassy and our consulates open. When circumstances begin to change and change positively, we'll obviously continue to look at that very, very closely and be prepared to take modest steps forward towards phase 1. And then there are 3 phases in the overall architecture of Diplomacy Strong. We're not there yet. We have noticed and noted hopefully the initial stages of a cresting and a decline, an overall decline in COVID numbers. We too are worried about a resurgence in COVID numbers after Eid. But we hope and we pray, as do our Pakistani friends, that the overall trend is a positive one. And if that is true, we look forward to making decisions about staffing and embassy services at the appropriate time. Unfortunately, we're not there yet.
Thank you so much, Mr. Massinga. I would like to invite Dr. Jalil Khan. Dr. Jalil Khan is past president of PACPAC, and he has a question. Thank you.
Thank you, Dr. Ali and Dr. Usmani, for arranging this remarkable meeting. And Mr. Massinga for taking time over the weekend. I have a question which is not related to COVID. It is basically, as we all know, the violence again has not ended in Afghanistan, and it is affecting Pakistani border states as well. So what is your perspective and US perspective in negotiation with Taliban, and where are we heading in this scenario?
Thanks for that question. On the policy side, that issue is uppermost in our minds. And it shows that even in the midst of the global COVID-19 pandemic, the issues, like critical issues of regional security, continue, and we have to stay flexible and able to address those. You're correct. The situation in Afghanistan vis-a-vis the violence is not where we want it to be. It's not consistent with the agreement that we reached with the Taliban on February 28th of this year. And this is and our sense that this is unacceptable has been conveyed to the Taliban directly. But we still have great an expectation and a hope that eventually, and in the not too distant future, that the Taliban and the government of Afghanistan will be able to sit down as Afghan brothers and sisters and begin a direct dialogue to work out their differences and find a way, a path to ending this long-standing conflict. But you're correct. The violence level is high, and it's too high, and too many people suffer. We take note of the violence that is seen on the Pakistan side of the border. Terrorist strikes in Pakistan have not ended, and this brings great tragedy to too many people. This is true in Afghanistan as well. So for the people of the region, for the people of Afghanistan, the people of Pakistan, it is essential that the guns eventually begin to fall silent, that dialogue, real dialogue commences, and that a durable solution, a durable peace is established. It's been too long, and we fervently believe and have believed for a long time that there is no military solution to this conflict, but a durable political solution that takes into account the needs and the perspectives of all has to be addressed, has to be achieved. We work with all of our friends in the region, including the Pakistani government, to encourage the formation or the beginning of this dialogue, and we will count on all countries in the region, including Pakistan, to support the eventual agreement that will be reached. This is not easy and has not been easy and will not be easy, but we remain optimistic and committed to that outcome.
Thank you so much, Mr. Massinga. I would like to invite Dr. Manzoor Tariq. He is past president of Appna, and Dr. Manzoor Tariq has a question. Thank you. Is Dr. Manzoor Tariq unmute?
Can you hear me?
Yes, sir, we can.
Okay.
Yes. Yes,
Good
sir.
afternoon. Assalamu alaikum, everybody. First of all, wonderful job, Kamran and Naheed, for arranging this program. And thank you so much, Mr. Massinga, for coming. And it is incredible. We have in the same line, wonderful relation between Pakistan and United States. If there were not good relations, these about 21,000 Pakistani physicians will not be in America. We are proud to be the second biggest in IMGs in United States of America. We serve, as you know, from the small town, who's the biggest institution. And as far as questions are concerned, I have a couple of questions. Dr. Naheed Usmani has an agenda in thinking about to help, primary school education system in Pakistan. I know your bureau might not have a direct impact on USAID, but definitely they will get to your advice and they listen to you. Because I remember during my presidency, 2011, we were so lucky we have a direct relation with the State Department and Homeland Security, White House, and our ambassador in Pakistan. And same relation has been built, and everybody is doing their best. So could you be able to help for you through the USAID, number one, for any elementary education? Number two question, you already have explained any more help from State Department through your bureau for all our young physicians coming from Pakistan. Once again, thank you very much, everybody. I stop there and listen for your answer. Thank you.
Thank you, Doctor, for the question and the opportunity to address it. So actually, your question helps me bridge back to something that I forgot to mention, and something that Dr. Usmani and Ali made reference to, which is the normal flow of residents from Pakistan to American institutions, which has always been a little bit difficult to achieve through the visa process. This year, we are very proud to say that the vast majority of those residents were able to get their visas and get to the United States and integrate into their communities faster than ever, despite the COVID pandemic. It was important to us, it was important to the American people to get these folks into the US and into their institutions and to be part of the fight against COVID. But this is a real win-win for everyone, a real win-win for both of our societies, and hopefully it's a real win for the residents themselves. You talked about primary education. The U.S. has a long-standing track record of investments in primary education in Pakistan and certainly in certain regions, Gilgit-Baltistan, Khyber in particular. But I think there have been investments that are paying dividends right now. And I'd be happy to, in fact, I will go back and search out specific examples of these gains and these investments that have been undertaken over the many years in primary education. But your point is a good one, that at the end of the day, it's important to recognize that the educational system in Pakistan is not as strong as it should be, that there are elements that are very good, that have produced people like you, but that it's an unequal system, and that too many young people in Pakistan are outside of the educational system or don't have access to high quality education. And this is something that concerns me very greatly, because looking long term at Pakistan's opportunities for prosperity without a solid educational foundation for all of his citizens, it's hard to imagine that Pakistan will be as competitive as it could be and needs to be in the rest of the 21st century. So, having said that, part of the conversation that I plan to encourage and foster under the MOU between Appna and USAID is to address the issue of primary education overall. Again, U.S. has a very good story to tell on education, primary, secondary, and tertiary. LUMS, as you all know, was founded in a partnership with the United States. So many institutions in Pakistan have benefited from relations with American universities and colleges. Agriculture in Pakistan has been a huge beneficiary of the Green Revolution and the various elements of the Green Revolution that have flowed from American research institutions and land-grant colleges. So that relationship, that educational relationship, is strong and vibrant and continues to be strong and vibrant. I know it's an area of intense interest by Ambassador Khan of the Pakistani embassy here to renew that and to strengthen that. And that's a partnership that we look forward to encouraging going forward. COVID has interrupted or delayed a lot of our plans, unfortunately, but those plans are just slowed down. They're not shelved, they're not put to the side. But again, in the conversation that we will have in the coming weeks with AID concerning the functioning of our MOU in this extraordinary time, clearly primary education issues need to be part of that conversation.
Thank you so much, Mr. Massinga. I would like to invite Mr. Ali Rashid to ask a question. Mr. Ali Rashid is not a physician, but he's a great community leader. He has done a phenomenal job on the platform of APAG. Mr. Ali Rashid.
Good afternoon, everybody. First of all, great work by Appna. Appna is a great organization nationally, and definitely great work by USAID. And thank you, Mr. Massinga, for a very informative session. I think there are a lot of things that you talk about that should be highlighted more. And this is a great platform for all the things that the Department of State is doing to help Pakistan. So my question is based on the Kashmir. As you know, the August 5th is the first anniversary of the revocation of the Article 370 by India, which has since launched a new reign of terror in Indian occupied Kashmir. The revocation of all the article has stripped the region of all autonomy and flooded it with military troops. Even during the pandemic, the region has not seen any respite to oppression. They are being denied PPE and other essential to help cure and contain the spread of COVID-19. The revocation is a clear-cut violation of human rights. Any program by USAID or Department of State that you know of to help the Kashmiri people, because they are suffering a lot?
Thank you so much for the question. We know this is an issue that is uppermost on the minds of many in the region and many people who have ties to the region. The U.S. has spoken out very forthrightly about the human rights and the detentions issue and the denial of full democratic opportunities for the people who live in the region. And that dialogue with our Indian friends continues. We have spoken out publicly, and as you can imagine, we have private conversations about it. We have seen some modest moves in the right direction in terms of releasing those who are detained and allowing greater access to communication technologies, but we have not seen the full results that we seek, and that dialogue continues. That's one of the key areas of focus of our embassy in Delhi, and those conversations are handled primarily through that relationship. They're not the easiest, but we have a values conversation with the government of India on that matter. At the same time, we talk with our Pakistani friends about the issues related to the line of control. Tensions have only gone up since the 370 revocation that you referenced, and it's the people of the region, both on the Pakistani side of the line of control and Indian side of the line of control, that suffer from that violence. So it is our strong view, and one that we have communicated to both countries, that a reduction in tension would benefit the people of both countries and is something that is needed urgently. We also talked to our friends on the Pakistani side of the border, particularly government officials, that it's imperative to maintain a strict prohibition against militants seeking to cause mayhem on the Indian side of the line of control. The situation on the Indian side of the line of control is already difficult enough, and just to quote Prime Minister Khan, those who seek to cross the line of control and commit violence on the Indian side are enemies of the Kashmiri people. We agree wholeheartedly. Let me stop there on that.
Thank you so much, Mr. Massinga. This is the last question. We're having Bilal Hamid. He's a hepatologist in California. Bilal.
Thank you, everyone. Thank you, Kamran. And thank you, Mr. Massinga, for taking time. I have a simple question. I know that USAID has a now new initiative about digital technology, and Pakistan, there's a lot of interest about this digital technology, and I wanted to see how we can be involved early on, not only to the health, but the access to internet, and can it be on one of the agenda so that Pakistan would be early on for this digital technology initiative taken by USAID? Thank you.
Great question. I don't have great information about this digital technology initiative, but I do know that Pakistan is well poised to take advantage of greater access to the international marketplace or digital marketplace. Pakistan, as you know better than I do, has a huge number of graduates and young people who are tech savvy and ready to start companies and join companies on the global marketplace. This is already happening. Pakistan and Pakistani people are already quite well represented in that space, and we'd like to see that engagement grow over time, grow strongly. The Pakistani economy has some impediments that slow down the ability of the digital economy in Pakistan to grow, and we are committed to finding ways to remove those impediments to allow the industries of the future to grow more intensively and more rapidly. I know that Open, I'm sure many of you are aware of the existence of the organization of Pakistani Entrepreneur Network. They have a huge interest in promoting the digital economy and have a regular series of discussions, seminars, and initiatives to promote that and to facilitate investment in that space. Again, were it not for COVID, we would have moved much more intensively and aggressively down that path. But I look forward to engaging with Open in the coming weeks around that very same issue. On the issue of USAID's digital economy initiative, yeah, I'll be talking with them about that and seeing what we can do to bring Pakistan into the fold. Let me stop there.
Thank you so much, Mr. Massinga. So I would like to ask one question as well. This will be the last question.
No problem, Dr. Ali.
Thank you, sir. We are about 1 year after the historic visit of Prime Minister Imran Khan to Washington. Much was discussed in the White House, in particular, deepening trade ties. We realized that USTR, and you have worked in USTR in the past, we realized that USTR is focused on a deal with the UK and Kenya. But what prospects do you see of any trade initiative, legislative or otherwise, between the US and Pakistan? Thank you.
Your question is very timely. So despite COVID and despite the massive inconveniences and disruptions imposed by COVID, Pakistan and the United States continue our discussions at the technical level and the working level related to trade. There are a number of issues and barriers that need to be addressed concretely that can aid and support the ability of international and U.S. investors already in Pakistan and who might be interested in Pakistan. That might help those who are exporting from Pakistan or who are interested in exporting from Pakistan expand their exports. In my prepared remarks, I mentioned that from challenges can come opportunities. That there is an opportunity to see good coming from bad. That's true in the economic realm too. We noticed that the huge reduction in the value of the rupee, in the Pakistani rupee, has made PPE production in Pakistan more competitive than ever, and that there has been an encouraging initial rise in exports coming from Pakistan. That's something that should be continued. That's something that authorities should take note of and find ways to ensure that existing barriers to that type of economic growth are removed. So with USAID and the Department of Commerce and Department of State, we're engaged in what we call a Trade Investment Framework Agreement, TIFA discussions. The name of the platform really is not that important. What's important is that our conversations with the Pakistani authorities and trade authorities is ongoing and is fruitful. And we look forward as we move away from this pandemic to see the results of that engagement bear fruit for the investors and producers and people of Pakistan as well as the American people. You talked about a free trade agreement. I don't think the U.S. is ready for that type of conversation at this juncture. That's something that people way above my pay grade would have to make a determination of, but I can say this. I can say that no matter what, removing the current set of trade barriers and investment issues would be essential for progress in any respect. So we need to continue on at our level to achieve that. And as that is being achieved, I think that opens up the opportunities for greater greater gains and more ambitious efforts. Let me stop there.
Thank you so much, Mr. Massinga. We truly appreciate you being here on this Saturday afternoon. I would invite Madam President to conclude the session. Thank you.
Thank you, Dr. Rao. Mr. Massinga, it has been a unique pleasure and honor to work with you and get your support for all the initiatives that Appna does. We wish you the best in your future endeavors, and we are going to miss you because so much can be done, has been done, and I hope we are lucky enough to get somebody as active as you in the Pakistani physician diaspora. I think COVID is here to stay. That's my own assessment. We were in a state of shock the first 6 months, but now we know, maybe we'll have a vaccine, maybe we won't have a vaccine, maybe there will be, spikes of this disease off and on over the next few years till we develop an effective vaccine or an effective way of treating. But we have to continue the collaboration and improve the healthcare, the education, the life for the indigent people in Pakistan, and that's going to remain our focus. And we do look forward to collaboration and furthering our work with your help and support. Thank you so much for sparing this afternoon for us. Thank you everyone who has joined us on this call. Thank you, Kamran Rao. Wonderful social forum, the first one, and I hope to see many down in the next 6 months. This has been very informative for all the people who joined live and on Facebook. Thank you so much, Mr. Massinga.
Thank you so much. Any final words, Mr. Massinga?
I very much regret that Appna did not have the opportunity to move forward with its annual convention scheduled for earlier this month in Washington, D.C., or in the Washington, D.C. Region. I think we were all looking forward to it. But as Dr. Usmani indicates, we have to adapt. We are adapting. And I think at the end of the day, we'll come out stronger. So my successor is already named. His name is Les Vigoury. I know he is eager to take up the mantle and take the baton of taking this relationship between the Department of State and Appna to an even more important level. And I will be reporting back to him the content of this conversation and establishing or setting a date for his initial engagement with you so that you can get to know him and we can very smoothly transition under his leadership. But thank you so much for this opportunity and for our collaboration over my 2 years. And who knows, maybe our paths will cross again.
Inshallah, as we say.
Inshallah.
Okay.